So the RESPONSE study tested Ruxolitinib as a second-line therapy for patients with Polycythemia Vera who were intolerant of or resistant or refractory to hydroxyurea. And we showed the results of the follow-up of this study after 5 years. And 222 patients were enrolled in that study, randomized 1-to-1 to either Ruxolitinib or best available therapy. And we are very pleased to see that after 5 years of follow-up, the response was maintained and durable. The probability of maintaining the response, the primary response at 5 years, was 74% in these patients, so very high persistence of response. In terms of complete hematological response, meaning that the hematocrit was below 45% without phlebotomy, but also normal platelet counts, normal leukocyte count. This also probability of maintaining this complete hematologic response at 5 years was 53%, so the median was not even reached after 5 years, so very nice results. We were also pleased to see that in terms of toxicity, the incidence of adverse events indeed decreased over time in Ruxolitinib treated patients, and the safety was very good. As usual, we have a slightly increased incidence of viral infection, like herpes zoster in particular, so we have to be careful with that, and also a higher incidence of non-melanoma skin cancer in patients on Ruxolitinib compared to BAT, but we also have to take into account that the exposure to hydroxyurea was longer in patients randomized to Ruxolitinib compared to the others, and also that these patients had higher previous history of skin lesions, pre-cancerous skin lesions. So viral infection, better surveillance of skin lesions, especially in patients who already had one, are maybe to take into account to follow these patients, but otherwise the efficacy and the tolerance on the long term is very good.